Welcome. I'm Dr. Misty Shields at Indiana University School of Medicine, and I'll be speaking today on the role of antibody drug conjugates in small cell lung cancer. With small cell lung cancer, there's truly nothing small about it. We know that small cell lung cancer is considered a recalcitrant malignancy of the lung that has heterogeneous biology that may make it more resistant to certain therapies after initially responding, that can allow it to become more easily metastatic, which may make it more difficult to treat. And while there's been so many advances for small cell lung cancer, unfortunately, many of our patients may succumb to the disease within a year or two of diagnosis, or breakthroughs are desperately needed for patients and families affected by small cell lung cancer. So, how do we improve outcomes in such a challenging disease? We know that with patients with small cell lung cancer, they may have a quick onset of symptoms such as a cough that lends to being evaluated in the ER at their doctor's visits. There, they may be diagnosed with small cell lung cancer by a biopsy or bronchoscopy. And when we find that diagnosis, it's usually followed by emergent treatment with platinum, etoposide, and a combination of radiation or immunotherapy, depending on the stage. We know that a large number of patients who are affected by small cell lung cancer will have initial responses to therapy up to 90%, which is due to chemosensitivity of the small cell lung cancer to initial treatments. But when the disease comes back, which is called relapse, the chemo resistance unfortunately usually follows, making this disease more challenging to treat. So, how do we overcome chemotherapy resistance and relapse in small cell lung cancer? We know that this unfortunately has been a problem for patients with small cell for many decades. Here you see a quote from Dr. Joan Schiller, a very famous thoracic oncologist who performed many of the pivotal trials for small cell lung cancer, calling out for help with the search of better treatments in relapsed small cell lung cancer being a high priority. And I couldn't agree more. How do we initially treat extensive stage small cell lung cancer? Traditionally, the first line therapy is chemoimmunotherapy, as shown here. These are Kaplan-Meier curves, or what we call survival curves, where each of these hashes may represent a single patient on a study. These are two different phase 3 studies looking at the role of chemoimmunotherapy versus chemotherapy, which is considered the standard of care at the time, and looking at patients' survival or outcomes over time. And what you can see as well, immunotherapy improves patients in those blue bars on both studies. We want to see that lifting of the curve to 100%. We want all patients doing well with treatment with small cell lung cancer. One study that looked at the improvement of this was recently presented at our annual ASCO meeting in 2025 with Forte, looking at the role of adding lurbinectedin to immunotherapy. And what we saw with this data was that it helped patients have less progression, what you can see here with the progression-free survival, that blue curve, less progression on therapy with the addition of this agent, and patients living longer, what you can see here with the survival curve, again, of the blue bar, demonstrating a lifting of the curve. But again, still much more improvement is needed. We also saw the Delphi 304 phase that 3 study that looked at the role of tarlatamab, a very exciting DLL3 bispecific T cell engager, compared to investigators' choice on chemotherapy agents, including topotecan, lurbinectedin, and amrubicin, which is only available in Japan. And this was the investigation of looking at this agent, tarlatamab, in the second line setting after chemoimmunotherapy. And what we saw is that patients lived longer with the addition of tarlatamab compared to chemotherapy in the second line. This was very exciting, but again, still we need that lifting of the curve. We've got to do better.